Okay, it's 6 o'clock and good evening. Welcome to the Parenting Genie live stream. It's your lactation consultant presenting for Parenting Genie tonight. And I am saying hello to the Australian community and also to people from around the world. Tonight I'm in country Victoria in a beautiful place called Castlemaine with beautiful artwork here in the house of a lovely friend. And what I'm talking to you tonight is a topic that many new parents hear about and sometimes worry about. And it is the topic of infant tongue tie. Now, tonight, I will be covering what is a tongue tie, how can it affect infant feeding, in particular breastfeeding. However, it can also affect the baby who bottle feeds. I will discuss treatment options, and I will discuss how it is being diagnosed, and I will talk about the evidence of having these tongue ties surgically released. So, to start off with, what is a tongue tie? Now, tonight I don't have any dolls or any material with me that I can show you, but I've got myself. I've got my mouth and I've got my tongue. So, a tongue tie is a short, thick piece of tissue that attaches under the tongue. So, if you see me lifting my tongue, you could actually see some bit of tissue in the back. It does not affect me and has not affected me. I think I cannot tell you whether I did breastfeed well, but it certainly hasn't affected my feeding journey. Now, there are different types of tongue ties. So they're the ones that you could see because a baby lifts the tongue and you can see a string of skin that attaches to the tip of the tongue. Then sometimes the tongue tie can also be a little bit more in the middle, and sometimes it can be quite far back. You may have heard the term posterior tongue tie, and posterior means always towards the back. It's really not visible. It has to be assessed and to be felt. So these different types can affect the function of the tongue. And that's what tonight's talk is about. It's not about what we see. It's about what it actually does. It restricts the mobility of the baby's tongue for effective breastfeeding. Now, not every tongue tie causes a problem. Sometimes it depends also on the anatomy of the mother's breast and nipple. So sometimes a baby who has a little bit of a tongue tie restriction may be perfectly fine with a mother who has got a protectile or an everted nipple. But if the mother has a nipple that might be a little bit more on the flatter or inverted side, then that might make feeding a little bit more difficult. So now, how can a tongue tie affect breastfeeding? To start off with, many babies could have problems attaching to the breast and latching and staying latched at the breast. And often babies may compensate and they try to really stay on the breast, and as they're kind of slipping off, you may hear some clicking sound, and that could be a reason to look for a tongue tie as well. The baby and the mother may experience long, stressful feeds. The baby keeps feeding, comes off, goes back on, goes back off, comes off, falls asleep, and fatigues during the breastfeed. The mother thinks the baby is finished feeding, and as soon as she tries to settle the baby is wanting to feed again. So, and then of course that could lead to also some issues with the milk supply and with slow weight gain. So babies who are not gaining weight, and you may remember 2 weeks ago I talked to you about what is expected for normal weight gain in a breastfed or even in just a bottle-fed baby as well. So that could be an issue. And then the mother may show symptoms as well. In fact, more likely that she feels that something is going on. So at first, she may experience nipple pain and nipple damage, and that is in the presence of receiving help with most possible good attachment and latching technique. The baby may come off and her nipple is really squished or shaped or blanched, we call it. So it's sort of flattened because the baby is pushing on the nipple. And there could also be other nipple compressions. Then some mothers report consistent blocked ducts, and that means that the baby is not able to effectively feed and remove milk, and consistency of blocked ducts can lead to mastitis. And then the cascade could also be followed by a lack of milk supply, or the supply is going down. And so they're the sort of main things that you would be looking for. Now, what does it mean when I say the baby may not be able to feed effectively? So effective breastfeeding requires the tongue to extend. Now, when I mean the tongue extend, the baby has to bring the tongue over the lower gum line, preferably over the lower lip. The baby has to be able to elevate the tongue. So elevation means the tongue tip can be lifted up to the roof of the mouth. And the other thing that is important for a good latch and good effective milk transfer is the cupping of the tongue. So when I talk about cupping, I mean this. So the nipple would be sitting in the center and the edges of the tongue would cup the nipple. So they're the main features of tongue mobility. We also often look at the baby being able to bring the tongue to both sides. And so these restricted tongue movements may prevent the deep latch. It may prevent good suction and, again, the effective milk transfer. So how is a tongue tie diagnosed? First of all, you will need to see somebody who is experienced in the diagnosis of tongue ties. This could be a lactation consultant, like somebody who is an international board certified lactation consultant like myself, who will do an assessment. And an assessment of a tongue tie doesn't just mean to assess the baby's mouth, it means to watch a feed and maybe even watch a second or third feed to really find out what is going on here. Now, some midwives or nurses, pediatric nurses, may have had special training and they can assess tongue function for an infant and do a suck assessment. Otherwise, it could be a GP lactation consultant or a pediatric GP or pediatric dentist. What they do is they will assess for some of these functions and other functions. And as I said, they will also observe a breastfeed. So the first part of the assessment is, can the baby lift the tongue? Because in order to get a good suction of the baby or the nipple in the baby's mouth, the baby needs to bring the tongue against the hard palate, which is there, and push the nipple sort of against the hard palate. So if I show you, if we think that this is the nipple, this is the palate, this is the tongue needs to push the nipple up against the hard palate to try to remove the milk. Then the next function is the extension of the tongue over the gum line, like that. So I'm not impolite. I am just giving you an idea what we're looking for. And then again, the cupping of the tongue, and then watching for the baby gulping the milk without splattering and without coming off and without gagging. Now, we also look at the appearance of the tongue. And quite often, babies have a milk coat of the tongue, and that's part of a tongue tie, or can be a part of a tongue tie, that they can't clear the tongue from the milk. And unfortunately, some practitioners think that it's thrush, and then the baby gets treated for thrush, but it's not thrush, because thrush means that the whole gums are full of white spots and the tongue looks like it's got cream cheese on top of it. But when there's a little bit of a white coating, it's usually milk coat and it can't be cleared, and it could be a sign that there is a tongue restriction or a tongue tie. Now, at first, we would always correct the attachment and positioning technique and make sure that the mother gets comfortable. And then we would look at the baby's sucking pattern, because the sucking pattern is also looking at the baby suck, 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 suck. The mother lets down or lets the milk down, gets the milk release. And then the baby starts gulping when the milk is released. Suck, swallow, suck, swallow, suck, swallow. If the baby is clamping or chomping, we quite often talk about it. And it feels like the mother feels the baby's gums on the breast or on the nipple. That means that the baby may actually have what is called a snapback. So the tongue tries to keep forward, but it snaps back with the sucking. So these are kind of issues with a tongue tie. Now, who would do a tongue tie release, and what sort of releases are we looking at? You would want to have a skilled practitioner, and there's different options, but there are surgical options. So the first one we look at is a frenotomy made with a pair of scissors to divide that little bit of skin that attaches the tongue to the floor of the mouth, to release that, to free the tongue. And then, of course, there is laser release, which is often done by pediatric dentists. Now, the scissor release can be done in a clinic. There is no anesthetic necessary. Some GPs may give a little bit of a local anesthetic. But remember, mums, your breast milk is an anesthetic as well. It calms the baby down. So if you decide with your practitioner to do a frenectomy or a release or division of a tongue tie, then you would feed your baby first, because the breast milk calms the baby. The baby often gets swaddled and wrapped up, so the hands are all kind of away. And then the baby will get that release or division with a pair of scissors. There may be a little bit of blood. Now, your GPs who may perform the procedure, sometimes it could also be lactation consultants who have been trained to do it. I'm not trained to do it. They would also suggest that your baby has had the vitamin K injection or the oral vitamin K to make sure that they have got no issues with bleeding. There may be a little bit of bleeding, but the baby can be breastfed straight away afterwards. Some babies can sleep through the procedures, and some babies may be a little bit upset, but going to the breast will help them to calm down quite quickly again. So in terms of side effects, it's a very safe procedure, very minor risks of bleeding or an infection, or also of no improvement. So the majority of babies who have had a tongue-tie division will improve with their feeding, and the mothers will notice often with the first feed much more comfort and less pain with breastfeeding. Now, let me go through a few more things. So the tongue-tie division, or the whole topic of tongue-tie, has still a lot of controversial opinions. The evidence that has been reported and has been written supports the phrenology, or the division of the tongue-tie, because it has been seen that most mothers have immediate improvement of their nipple pain, and the baby can latch better and is better in milk removal. And long-term studies have only done on small groups in terms of speech and solid food. So some mothers come to me and they say, well, I'm not so worried about the breastfeeding, but I'm worried about my baby's speech. Now, we do not have enough studies about that. And if it is about speech, we could also look at it later on in the baby's development. Always remember, breastfeeding successfully is actually a milestone for the infant or the newborn baby. When should you consider a tongue-tie assessment? As already mentioned before, persistent nipple pain despite good positioning and attachment, baby struggling to maintain latch, no or very slow weight gaining, feeding sessions extremely long or stressful, recurrent blocked ducts and mastitis. So you've all heard it before, I just repeated that. If you are not breastfeeding and you feel that you've got problems with bottle feeding, there is a reason for some of these babies to also have the procedure done. And if you can't give breast milk to calm your baby down, your practitioner might give the baby some sucrose, which is something that also has shown to help babies with pain relief. So the incidence of tongue ties in the population is suggested to be 3% to 16%. Now that's a huge, big gap there. And the reason for that is that these numbers come from different populations. So some populations in some countries have more tongue ties than in other countries. It's not something new. It's been described since the 16th century. So there's been tongue tie releases even in those early centuries. In Australia and also in England, it's not part of a newborn assessment, like a newborn examination, 6 to 70 hours after the birth. A baby would have a top-to-toe examination by a midwife or a doctor to make sure that everything is fine, that the heartbeat is there, that they have got everything that they need, all the toes, everything is there, top to toe, as I said. But looking for a tongue tie is not part of a newborn examination. So that's why you may wonder, why did it get missed? Well, it didn't get missed because it's not been looked for. And it really probably should be included. This, however, is different in Brazil. If you watch this from Brazil, this would not be applicable for you because it is statutory requirement to assess newborns for a tongue tie. How about that? So the evidence and the research also says that early frenotomy within the first days to the first month has benefits in preventing breastfeeding problems, reducing maternal pain, improving feeding outcomes, and it can prevent the cascade of interventions such as bottle feeding, formula introduction, nipple shields, pumping. Because when you have gone into that cascade of intervention, it's quite hard to wind back this. What else have I got to say to you about tongue ties? I think we have pretty much come to the end of this presentation. I think yes. So if you want to comment on anything down in the chat or so, then that would be really good. And otherwise, please remember, Parenting Genie website has got lots of information, and you can make an appointment with any of our practitioners online through parentinggenie.com.au, and we could do an online assessment, which is not as good, mind you, or can advise you in any other way. So that brings me to the end of today's educational session. And yeah, it's summer here, so that's really good. So thanks for listening today. And yeah, I'll see you in another week's time. Next time with a baby wearing topic again. And there's one thing that I actually would like to mention before I finish. You may also have been Googling, or you might have looked at Facebook at different groups. And some people are really worried about what is called a labial frenulum or a lip tie, which is this there. Now, there is definitely no evidence that that makes a difference to breastfeeding, because the lip, the top lip, does not have to go out all the way. That lip is in a neutral position against the mother's breast. And if you have heard of other different tongue ties in the baby's mouth, I would suggest really go and have a proper assessment before you make any decisions on the procedure. On that note, see you next time. Bye.